I'm Dr. Payal Mukherjee. I'm an adult and paediatric ENT surgeon with a special interest in hearing and balance disorders. I work at the Sydney ENT Hearing and Balance Centre, which is located at the Sydney Adventist Hospital. So the most common childhood condition we see is glue ear, and that's the bit that doesn't get picked up in the screening program. And by and large, what glue ear is essentially, so children have, all of us, we have a tube that connects the ear to the back of the nose. It's called the eustachian tube, and it's particularly important because it's what allows air into the middle ear, which is this part of the ear behind the eardrum, and that part needs to have air so the eardrum can conduct sound properly to the inner ear. Now, children's eustachian tube in kids are smaller, shorter, and more horizontal, so they tend to get infections every time they get a cold or a cough. They're more predisposed to getting middle ear infections. Now, the infection, the active pus or bacterial part of the infection may resolve away once the cold's resolved away, but the child may have something called glue, so fluid remaining, that's not acutely infected, and it can hang around and become thick and stringy, that's why glue, and not drain away naturally through the eustachian tube. And particularly children also have around this age enlarged adenoids and tonsils, and the adenoids sit very strategically covering up the eustachian tube. So the bigger the eustachian tubes adenoids are, the more likely they are to block the eustachian tubes. And so they particularly have problems draining the glue by themselves, which means they may go through months of hearing loss, which is quite easily fixed, but they may, it's not painful, but kids don't know any other way. They don't know what normal hearing is, so they may not complain, but they've gone through a lot of a prolonged period of sensory deprivation that affects their normal learning and development. And so they might struggle in school, or they might develop a speech delay, particularly the toddlers, so 1 to 2 years, where they're hearing a lot and they're developing quite rapidly, but they may not express it in their speech, so they may not actually present for a year or two down the track when the parent goes, my kid's 2.5 and they're barely saying a certain amount of words, and we've already lost so much time in that child's care, and particularly daycare and preschools where there's an explosion of bacteria and viruses. Kids are more likely to pick up problems earlier, and second kids, because the older kids are bringing it to the younger kids, so it's siblings of kids who are in preschool and daycare, they may get problems earlier as well, even though they're not really in daycare or preschool. I think especially if their children are having lots of coughs and colds, flus, snoring, all of that, they're red flags in terms of starting to have a hearing test. It is not invasive, but it's good to have that screening tool, and particularly when kids are young, so 1 year, 2 years. Of course, if there's any major concerns, such as there is speech delay, obstructive sleep apnea, they will present to an ENT surgeon eventually, and that's where the GPs need to be really proactive in saying, just go see somebody. It's much better that you're told that you're normal rather than, because you can fix it, right? You can fix it if there is a problem. Early intervention is so crucial. You can actually, if you get them in early, you can get them out without needing any surgical treatment. And I think that's the key. That's what we're trying to aspire to. And I'm hoping that when parents sort of pick up those early problems, and they're going to get better and better at and the more accessible we make our services, they're going to get better and better at accessing those help, so we can screen them and either pat them up on the back to say you're fine, see you next year, or if there's problem A, B, and C, or we can kind of go, you're not fine, but we'll get you. There'll be a monitoring system, and we'll start some treatment, assess you depending on what the problem is, and intervene if necessary.